John, hi.
Hi.
Good. You had come in today for personal issues, you said? And in the process of filling out the forms that you had to fill out, you'd said that you were using prescription opiates prescribed for you for pain. Can you say a little bit about that?
Yeah, I have some pain on my shoulder, so I used opioid, prescribed opioids for my shoulder pain.
Okay. So, because we have an opioid crisis in the U.S., and people who are using opioids often aren't aware of the risks that could befall them if they're using opioids, would you mind if we did a small assessment of your opioid risk?
No, I'd be okay with that.
Okay. So what I'm going to do is just ask, I'm going to give this to you, this opioid risk tool, ask you to read the questions out loud, and mark whatever answer you have there. Would you do that?
Yes.
Thank you.
No problem. Family history of substance abuse, alcohol. Personal history of substance abuse. It says drugs, but I take all prescription drugs. I don't think so. Age between 16 and 45, yes. History of preteen sexual abuse, no. Psychological problems. I would say depression could be one.
Okay. Can you say a little bit more about that? You had come in for some personal issues and you think that you're depressed?
Yeah, I had a very severe injury when I was younger, and my shoulder's in like a lot of pain. When I went to go see a doctor about it, he told me it wasn't going to cure itself. I needed to get surgery, and he transferred me over to a surgeon who told me about the procedure. Like, I was taking the prescribed medication for the pain, but he told me the same thing, that surgery was required if I wanted to get better and heal the injury. It's just, I'm a little scared of surgery because just being out for so long, I don't know how that experience will go over with me.
Okay, so I'm hearing that you're hearing that you need surgery for the injury in your shoulder, and you're a little bit scared about the whole procedure.
Yeah, pretty much. It is terrifying to go through that for me.
Okay. And so you're feeling a little bit depressed along with the idea of going for surgery. Is that kind of where you're coming from? Okay. So would you go through that and see if any of the scores that you have on for those questions are over 1 any place?
I would say alcohol. There's definitely more than one. I don't know right now.
Okay. So there's a family history of alcohol abuse or alcohol misuse?
Yeah. I have memories of my father being an alcoholic when I was younger. Definitely drank a lot. Kind of scary when he was drunk. It was kind of just like, don't mess around with him, don't get in his way, just like, don't even let him see you because you never knew what was going to happen.
Okay. So this could be important. It could make it a little bit more risky for you to be using prescription opiates even though you're under a doctor's care. Would you mind if, as kind of our standard operating procedure, I have you sign a release for the physician who's prescribing the opiates so that we can talk?
Does it have to be done? Just feels
It feels
a bit invasive, I would say.
okay. So you're feeling a little uncomfortable with that, and the reasons that we would have for doing that are that because you indicated that there's a family history, you're at a little bit higher risk than somebody who doesn't have a family history. And it would be important for us to, me and the doctor, for instance, to talk about if your opiate use is affecting your mood, like you're coming in for depression, or if some other kind of drug could possibly be prescribed if it's not working for you.
So it's kind of like what the surgeon made me do so that he can get in contact and talk to my doctor.
Right. It's just a case management kind of release.
Okay, I mean, if it's standard and you feel like it will help, I'm okay with that.
Wonderful. So then we're going to talk further both about your depression and about the family history that you have as you come in and talk about your personal issues.
Okay, sounds great.
Okay,
Yeah.
wonderful. Thank you so much for
No,
filling
thank you.
out the form.
No, thank you.
I'm looking forward to seeing you fill it.
Same as well. Thank you very much.